Members, we have a quorum, so I call this meeting to order. This is a special meeting. We have invited the administration to brief us on drug treatment and rehabilitation services, so I'll invite the administration and deputations in first. Yes, let's invite the deputations in as well. Good morning. Good morning. Your name tags are on the table. Now, for this item, apart from the panel on welfare services, we have also invited members of panel on security to join us because this covers two panels. Good morning. Now, the arrangement today will be as follows. The administration will walk us through the relevant policies first, and deputations will be invited to speak. I will allocate 5 minutes for the administration and 3 minutes for each deputation, including our members as well. And we have the relevant devices. That's the e-peers here. We have channel 0. That's in front of you on the panel for floor, and channel 1 for Cantonese and channel 2 for English. Okay. So if you need assistance, please ask our staff to help you. So may I welcome the Commissioner, and please walk us through the paper. Thank you. Madam Chair. Well, first of all, I'd like to thank the panel for inviting us, the Narcotics Division, Secretariat for ACAN, to brief members on our policy. We adopt a 5-pronged strategy which involves education and publicity, namely APIs on TVs and education initiatives in schools. And we also have legislation and law enforcement. We tackle the problem at source. As far as legislation is concerned, we update the schedule of dangerous drugs and poisons on a regular basis. The third area is T&R, treatment and rehabilitation, which is the focus of our discussion today. The fourth strategy is external cooperation. We have been cooperating with other jurisdictions. And number 5 is research. For example, popular dangerous drugs in Hong Kong include, for example, ketamine. And our research on ketamine is well advanced comparing to other countries because ketamine prevails in Hong Kong. And on the physical, the harm to physical health, etc., we have abundant research. And for TNR, treatment and rehabilitation is one of the 5 strategies. And it involves various sectors. Apart from social service, we also have healthcare, education, and aftercare services. For example, after the treatment service, enterprises help in providing jobs to rehabilitees. So on a number of fronts, for example, early identification of drug abusers and drug treatment and rehabilitation services. These are the works of the initiative. Now, for drug treatment, sometimes drug abusers may be asked to go to counseling centers to undergo drug treatment service. And we also have residential drug treatment facilities providing a 1 year or 2 year or 3 year plan for drug abusers to get rid of their original environment and rehabilitate in another setting. And after drug treatment, assistance is required to help them reintegrate into society. And we have organizations helping them as far as job placement or other religious support is concerned. The remaining paragraphs in the paper set out our work in TNR, and I won't repeat them. And I'd like to mention that on the 25th of September, the Action Committee Against Narcotics, ACAN, launched a 4-month consultation exercise on RDT, a rescue drug testing scheme. We reported to the panel on the 5th of November our progress of the ongoing consultation exercise. We also sought views from various sectors. Now, in 2008, Mr. Wong Yanlong, Secretary for Justice, chaired the task force on youth drug abuse, and 78 recommendations were put forward. And 5 years down the road, apart from drug testing by law enforcement officers, we have either considered the recommendations or implemented the recommendations, and we have also regularized some of them. Now, although the newly reported drug abuses have gone down in number in recent years, in terms of their drug history, it has substantially lengthened. So we're considering whether we can do more in this regard. And after discussion, the ACAN has put forward the RDT, a drug testing scheme, for consultation to see if we can identify drug abusers at an early stage and help them with drug treatment.
The recommendation is if a person has symptoms of drug taking and if there are suspicions of drug taking paraphernalia, then the law enforcement agencies can test the subject. This is not to prosecute, but to identify them so that they can be referred to social workers or medical professionals. We held 4 public consultations in October to hear the public's views and also generate atmosphere of discussion. And in fact, different organizations have held different talks after our event. ACAN had taken part, and we are aware that there are more coming up. Lastly, if the public really support this, we will continue to communicate on the details such as protection of human rights and follow-up work. We are aware that follow-up is important because whether these cases can be identified will determine the success or failure of this program. We will also continue to report to the Security Panel of Legislative Council. That would conclude my report. So before deputations raise questions, I need to remind you that you are not covered by Cap 382 powers and privileges of Legislative Council, and your written submissions are similarly not protected by powers and privileges. So now let's invite deputations. Mr. Zheng Yiu-kwong, the Human Rights Monitor, are against the community drug inspection because it infringes upon human rights. Whether it infringes on human rights depends on the two-pronged test. This test has to go through 3 steps. The first step is whether there is a legal purpose. Of course, early identification of drug abuse, there's no contest on that, but for allegations of serious crimes need serious measures. But drug taking is not a criminal activity that would lead to a sentence. It might only receive a treatment sentence. In fact, in the UK, drug takers are seen as victims. So we cannot give police greater search powers because of this minor offense. And second, is there a rational connection between the means and purposes? Well, if you could detect drug abuse, does that mean that you can kick the habit? Well, this is the same as the theme of the paper. Can drug detection aid drug rehabilitation? In fact, there might be the opposite effects. The more you detect them, the more the people hide away. So this measure infringes upon human rights. So the burden of proof rests with the government. The government needs to prove that this policy is effective, but the consultation paper does not indicate any of such. Third, this measure has to be appropriate. If there are other alternatives, then we need to choose the alternative with the least human rights impact. But Human Rights Monitor feels that this is inappropriate. As the government official said just now, drug abuse is improving. If the situation is improving and if we increase police powers, it is hard for the public to accept. Another large concern is that this might be an area where there might be abuse. The paper says that there's a high threshold for a search. First, there has to be strong circumstantial proof. It is not a search there is no body search, and there has to be drugs in the nearby vicinity. And this is also debatable, and it could be found in the adjacent room, and there's also a large abuse. There's potential of abuse. The adjacent area. Next, we have Mr. Andrew Sheng from Civil Human Rights Front. We also object to the drug treatment and rehabilitation service, the community service. In your consultation paper, you say that the number of years of drug taking went up from 1.9 years to 4 years, and between the ages of 21 and 30, it went up from 32% to 38%. But we also see that figures from the narcotics division, it has dropped 54% over 4 years. If you feel those under 21 years, if that is improving, then I'd like to ask, how are you going to detect the hidden drug takers? How comprehensive and credible are your figures? So this is an important part of your anti-drug policy. But looking at the figures, it is incredulous. You're saying the situation is improving. You're now saying also that a lot of hidden drug takers. If there are a lot of hidden drug takers, does that indicate that there is a misdirection in government policy? Now, if there is a misdirection, then why do you want to push through the community drug identification work? We find this very strange. On the other hand, we also see a lot of supporters for drug testing. They say drug testing is like the alcohol breathalyzer test. They think the logic is the same, but we do not. We disagree. Drug taking or driving under the influence can lead to fatal consequences. But drug taking, there are consequences to the individual. That's the first difference. You're saying that it would create social and medical costs, but a lot of incidents give rise to social and medical costs. Do they have to be dealt with by punitive measures? Is this the best choice, by increasing police powers? And when you say drug taking leads to social costs and social problems, I want to point out that the relevant government departments, they have not identified it as a social issue. Is it just a leisurely pastime? No. There are social problems, work problems, education problems that lead to drug abuse. You have not tried to identify problems behind the drug abusers. So we object to the drug testing. We don't see reasons. You're saying there are a lot of hidden drug takers, but now this policy would lead to more hidden drug abusers. Mr. Lam Hei-seng from Christian Zheng Association. We have a mission to support the drug treatment and rehabilitation service. I just feel that there's one unsatisfactory area where we would have a large trawling net, but the net spacing is increased and we aren't able to catch the fish. So when you identify a suspected person and there are suspicious drugs in the vicinity, and that would lead to a search. In my report that I have submitted, I don't want to go into details, but I want to emphasize that in my work experience, I've been a full-time drug rehabilitation worker for 30 years. In recent years, a lot of families that approach me indicate their helplessness. Their children are 18 or older. There's nothing they can do, and they see the damage to their children, and they have no intention of kicking the habit. I have also suggested, and they have even, family members have even reported their children to the police. Their children are dizzy and senseless, but when the police arrive, they can't find any drugs. So that's why I object to the finding a drug-taking paraphernalia. Then the family members say, well, he's abused drugs. And the police say, there's nothing I can do. According to the law, I can't conduct testing. I can't interfere. But they leave. So that is the complaints family members air. So if you urge them to to bring the children to rehabilitation center, but I tell them when an adult When an adult wants to break the law, drug taking is a breach of the law. Well, who can stop them? There is a loophole in our current legal system. So what I recommend is we should not have the condition of having drug taking paraphernalia. We should interfere. We should intervene. And why is this related to human rights? Because it's a health medical issue. There should be intervention to help them, to help their family members, to help the community. So under these conditions, I think the government should intervene. When police intervene, we're not talking prosecution. According to the document, these drug takers are just referred to NGOs, social welfare groups. So I don't see how the human rights are affected. If they are a drug taker, they're already breaking the law. But if there's no prosecution, that would safeguard their rights. We have Mr. Tan Siu-chuk from Christian Zheng College. I've been in this line of work for 18 years. I deal with adults, students, youth. The clients tell me that some 10 years ago that there were hidden drug takers. We have hidden drug taking centers. Drug taking, initially they might go to parties and come into contact with drugs, but eventually it becomes a hidden personal activity. Some of my students tell me that 10 years ago they went to entertainment establishments, and when the law enforcement agents arrived, they would just discard the material on the floor. So this isn't a problem arising today. It has been long-standing. And we've also heard that drug taking being described as a individual behavior. But in a recent news article, a person chopped his family members while he was under the influence of drugs. Why would he chop his mother and elder brother? This is not an individual issue. This is an issue of domestic violence. Even the neighbors might be affected. One speaker mentioned success ratio just now. I think the Hong Kong government has been handling drug problems for 50 years. They should examine which programs are efficacious. There should be a framework out of the different drug-taking rehabilitation measures. Some people would feel that quitting cold turkey is very hard, but in my 18 years experience, if there is suitable infrastructure, a lot of people can succeed and the success ratio can be high. When I did a study a few years ago, I followed up my students for some 5 years, and I found that the success ratio was very high. Of course, some people might question the figures, so I think the government should do more studies so they can demonstrate to the public that community drug testing is a viable option. So I agree that the earlier we detect these people, the earlier we can intervene and help them. And my students tell me that they misunderstand that it's safe, that the police can't gather evidence. I think this can help the law enforcement agents to help them legally.
Right, thank you. DAB, Ms. Zheng Fan Lang, Deputy Spokesperson of Welfare Services. Members, deputations. Now, after the drug habit is formed, the drug abuser the majority of drug abusers will display antisocial behavior or socially unacceptable behavior because of drugs. They may even breach the law. Now, for themselves and their family members, there may be a far-reaching impact. And many deputations already mentioned that the drug abusers are getting younger. And they are our next generation. They are our future, so it will have an impact on overall social development. So drug problem is not a personal problem. We must face up to it. It is a community problem. Apart from drug abusers getting younger, drug abusers tend to hide away now. That's why there is a proposal of a community drug testing scheme. It's controversial. We have various services, but as far as manpower ratio and quality is concerned, we must strengthen our effort. Outreaching social workers or school social workers, for example, these are imminent. Many services can no longer meet the present needs. They simply cannot keep up. For facilities provided by the government, for example, you have methadone clinics run by the Department of Health, but this is outdated, and the clinic only serves heroin users. For soft drugs, the clinic cannot help them. And our service model is quite passive. It's not preventive. So our services are not adequate. And we need to step up education as well. There are video APIs, and the APIs threatens people of the harms of drug abuse, and we need to find out the crux of the problem, because drug abusers would have known the harms of drug abuse. And for education, you need to take a focused approach instead of large exhibitions and seminars. Otherwise, we won't get in touch with those hidden youths. Thank you. Next, Ms. Cherry Lee. I help female drug abusers. Over the years, I found that they have complex problems. Now, in this consultation exercise, we've been asked to give our views, and surprisingly, the drug abusers are supportive of the program. The rehabilitees in our residential services. Now, there are concerns over details, for example, whether law enforcement action by police officers will make the youths hide away. And there is a suggestion whether healthcare staff should be asked to do the test. Now, I serve female drug abusers below the age of 29, and they told me that they have been hiding away for at least 3 or 4 years before they sought help, or perhaps not until their family members called the police, and not until they got arrested by the police that they find suitable drug treatment services. Perhaps I should read out some of their feelings. One of them said that they are in support of the government scheme because she was once a drug abuser, and many drug abusers don't understand the long-standing effect of drug abuse. They should not stop taking drugs only when physical symptoms appear, and this drug testing scheme can help them stop early. And another rehabilitee says that the scheme would help them reintegrate into society, and if she have had this drug testing scheme, she would not have had this consequence. And for the first, when I first got busted, I should be subject to hair testing or urine testing, and that's her feeling. And these are the concerns expressed, and my position is that, according to media reports in the past 2 years, I think the police and the CNE have been making effort in detecting drugs. You see news every couple of days, and we also read about some horrible news. As mentioned by Mr. Chen just now, a drug abuser chopped his family members. And when you read the details, you will understand that it has to do with his drug-taking problem. So this is not a personal problem. This is a family problem. This is a community problem. It affects us all. So we need to discuss the implementation of the scheme. Next, Ms. Mary Gibb. Good morning. I'm a frontline social worker in helping male drug abusers above the age of 25 to quit drugs. Now, as a frontline social worker, I support the scheme. The harmful effect of drugs is not only confined to the drug abuser, but family members as well. I got in touch with family members, and many of them display depression or emotional symptoms. And sometimes the family members say that when their son is sent to the rehabilitation center, their family members could finally have a good night's sleep. So this problem also troubles the family members. Another characteristic of drug abusers is that they understand the harmful effects as well. However, it's very difficult for them to make the first step without any encouragement. The drug abusers that I serve have a long history, at least 4 to 5 years. And for drug abusers taking ketamine, for example, not until they pass jelly-like substance or blood in the urine would they realize they need to quit drugs. And they support the scheme as well. They say that before they're admitted, they don't want to be compelled to quit drugs. They want to do it voluntarily. But it takes several years' time before they have this determination to quit drugs. So I think the scheme could help them and motivate them to seek rehabilitation service. And some of them might have been sentenced to probation order and admitted to the center. And it's time for them to reflect on their misdeeds. And I agree with some speakers who just now said that drug taking is not just a personal problem, but the community problem, and there are also issues like confidence issue, etc. And the abuser must quit drugs to deal with these problems. And there are also concerns, for example, whether the police would arrest them indiscriminately. And there are also some youth saying that the police might abuse the powers without the scheme anyway. Thank you. Next, Mr. Dennis Cheng. Thank you. I'm a frontline social worker. In my area of work, I very often receive phone calls from parents they very often tell me that their children are taking drugs for, they have been taking drugs for 3 or 4 years already, and what can be done. So I will intervene and see what help can be provided. Sometimes the parents may tell me that their son is recently displaying violent behavior and emotional problems, and the whole family is very concerned. They're also very worried whether all of a sudden the son would take out the chopper and hurt the family. So they're very worried, and I asked whether they have advised the child to receive rehabilitation service. And they say that they have been doing so. They have been asking their children to quit drugs for 4 to 5 years. So I would tell them that if they're unwilling to be admitted themselves, there's nothing we can do. And the parents ask whether they should call the police, and I would explain to them that possession of dangerous drugs is hard to prove, because under the existing law, the drug abuser cannot be arrested simply because he has signs of having taken drugs. So it seems that I am passing the buck back to the parents. There's nothing I can do to help, so I support the scheme. There are concerns that if the drug testing scheme is implemented and if the drug abusers are sent to a residential setting to quit drugs, they do not have the motivation. But I can say that I was once an abuser, and originally I didn't have the motivation to quit drugs. But when I was in a confined setting, I met some social workers, and I used to be a heroin user. Having taken 4 or 5 years, there was no substantial harm to my body. But for ketamine, the drug abusers tell me that every 15 minutes or so they need to pass water, and even if when they're home and they're sitting on the sofa, they need to put a bucket next to them. So it's really saddening to learn this. If they are admitted into the drug rehabilitation system at an early stage, it will definitely help them. Some of them think whether residential treatment center will be like a prison, but in fact they will change their concept once they are admitted. For first-timers, after they were admitted, they might be released, and in the open setting, perhaps after 3 to 5 months, they find themselves incapable, and they will be very willing to come back again. So I support the scheme. Next, Mr. David Low. Good morning. Thank you. I am a social worker working at a residential drug rehabilitation center, and I have some ideas I'd like to share with you. There are cases in which parents reported their children to the police themselves, and for youths coming in our hostel, very often some of them might see their parents as enemies. Now, the parents might say that I'm doing it for his own good. I don't want him to go down the wrong path.
They don't understand why parents have to take that final step. In my frontline experience, we have to help rebuild relationships with their client's parents. A young person might be taking drugs for a few years. They're very street smart. They won't go out of their house. They will have their friends purchase their daily necessities. They have strong hatred against their parents. And the parents tell me that I want the best for my son. What can I do? We help them rebuild family relationships, family harmony. And parents don't want to take the step. But if there were some solutions in the community to help the young people, because family support is very important in rehabilitation. We have to spend a lot of effort to build a platform for communication. So if there were early intervention measures, the drug taker and the family might not have such large conflicts. And in some of my recent cases, I find there are emotional problems amongst the clients. Some drug takers can't even write their name, and through referrals and psychiatric professionals help, we can help identify these early problems. As a frontline social worker, I want to provide a full service when we deal with cases at the hostels. We don't know whether they had psychiatric problems first or were it drug induced. So if there were early intervention to help the young people, they might be able to alleviate the symptoms and harm to their acquaintances. Mr. Barry Wong from Society for Aid and Rehabilitation of Drug Abusers. We have provided services for more than 52 years. In the last decade, we are serving first generation drug takers amongst in our guidelines, the work guidelines. We're talking about drug takers who have done drugs for 8 years. Their physical ailments have already affected their brain, bladder, kidney, and so on. And they also have psychiatric problems, for example, depression, schizophrenia. In a lot of media reports, we see people who have taken psychotropic drugs. They can chop their own hands, and when it's connected, they chop it off again. As stated just now, these psychotropic drug takers can chop their own family members. They can chop their neighbors. So drug taking is just it's not an individual problem, because they live in the community, they live right next to us. So this is a bomb just waiting to go off. As a matter of fact, one person taking drugs, it affects the whole family. A lot of our service targets, they have kicked the habit through their efforts. They are full of remorse, and their family members tell us in tears that if there were some mechanisms to help them deal with their drug-taking problem, then they wouldn't have wasted so many years, they wouldn't have damaged their bodies. So if a person takes drugs on a daily basis, do they have any analytical ability? Can they seek treatment on their own? Our experience tells us the possibility is very low. So drug treatment and rehabilitation is not just a security public health problem. It's a life-saving, especially a young person's life-saving measure. So I hope there should be more consultation among society, and we should start the program as soon as possible. We should intervene and help these young drug takers. Christian New Life Association, Reverend Zheng. I used to be a drug taker. I've kicked the habit for 30 years. And I'm also doing gospel drug rehabilitation work. I'd like to share some of my views. First, I have witnessed the change in drug taking. In my years, it was heroin, and even earlier it was opium. Now we see psychotropic drugs, pills, and now we have psychotropic drugs, ketamine, coke, ice. So the drug culture in Hong Kong, compared to the past, is only worse, and compared to the opium days, the consequences are more severe. So I feel Hong Kong's drug policy is behind the times. We are not as flexible as drug dealers. We're not as up to date as the drug takers. So I feel the government needs to be more aggressive. They should take the initiative to develop policies to stop the spread of drugs. 10 years ago, we didn't know that ketamine could be so serious. We don't know what the next fashionable drug will be. Drugs are now synthesized in laboratories. We don't know what will happen when you mix the different drugs. So the government needs to take the initiative. You cannot react passively. We need to take it one step further to prevent drugs from harming our youth. And I'm very surprised at some people saying that drug taking is not serious, it's a personal problem. You can't look at it in the face and pretend it doesn't exist. You hear reports of the drug takers that attack their friends and even mutilate themselves. We see young people's bodies falling apart. And I would like to talk about the hidden drug takers. That's one method of drug taking. Drug taking is legal, and they do it and this behavior, or this is driven underground. Because of time constraints, I would just like to share these few points. Mr. Moses Mui, Hong Kong Council of Social Service. I'd like to emphasize the whole purpose or rationale for the drug treatment and rehabilitation would receive support of social workers, because we're talking about early detection. But as a lot of speakers have said, the drug taking scene is changing very rapidly. The effects on personal health and family relationships, these impacts are very severe and urgent, but we feel that we can come to the conclusion that early detection and intervention is important and urgent. In our past discussions, we have raised a lot of questions. That is, even though drug taking is very serious, we need early detection, but is drug detection the best methodology? In order to answer this question, we need to look at overseas experience. The consultation paper refers to Sweden's drug detection program, but when we want to look at actual results, we don't find very clear-cut proof that drug detection programs are most effective in early detection and intervention. So given these circumstances, we see in providing social service work, early intervention, there are a lot of early intervention methods. There are outreach programs, parent support, helping parents, detecting whether their children are taking drugs, or even cross-sector cooperation. For example, social workers are working with Western medicine doctors and even traditional Chinese medicine practitioners. So we have 2 more months of consultation, and if we want further discussion, we expect or we hope that there's more clinical data to help us identify drug detection efficacy. So ACAN, or when they lead the discussion, they can provide more information for a deeper discussion. Thank you. Ms. Bonnie Leung from the Civic Party. The Civic Party agrees that drug taking is now driven underground, and it leads to increased demand for drug treatment and rehabilitation. We have residential care and clinic outpatient care to help reduce dependency on drugs, and also providing isolation from the drug-taking environment. Hong Kong has 40 residential care centers and midway houses, and out of them, only 20 have received government funding. We have 3 financed by the health department. They provide 404 beds. The SWD subsidizes 6 NGOs, 14 hospital care centers, providing 357 seats, and compared to the 10,000 drug takers, the number of beds are much less than the demand. And the health department waiting list is some 14 weeks. So the Civic Party feels that it understands that the rationale behind mandatory drug testing, but before implementing these programs, we need to have sufficient rehabilitation facilities. After detection, if there isn't rehabilitation opportunities, then drug takers will only be labeled, and it doesn't help them kick the habit. In this consultation exercise, there is no prosecution after detection, but just relying on these measures to target drug taking is not necessarily effective.
Now, The Economist in 2009 March, in an article, there was an explanation how to stop the drug wars. That was the title. Law enforcement cannot resolve the problem of drug abuse. So we need to seriously consider the effectiveness of the rescue drug testing scheme and to treat drug abuse as a public health issue. It's hoped that we can help drug abusers in quitting drugs as soon as possible. Thank you. Operation Dawn, Ms. Flora Siu, Assistant to General Secretary. We represent Operation Dawn. We provide residential service for female and male drug users. We support the rescue drug testing scheme. Drug doesn't only affect an individual, it affects their families and the community as a whole. As a frontline worker, I'd like to share with you, we have drug abusers in their 20s, females and males in diapers when they're admitted. Sometimes they're given up by their family members, they're homeless, and there are drug abusers coming here for drug treatment, and our social worker may need to take them to a urologist and a psychiatrist for follow-up treatment. And we have inmates going to court today. Drug taking has to do with criminal offense. So this is not an individual's problem. There are family problems behind. We have couples coming to the center to quit drugs. Their children will have to be looked after by their grandparents. The grandparents need to work in order to support the child. So this is a family problem as well as a community problem. We have rehabilities we have children studying in primary school, and the father died from taking drugs, and nobody dared to tell the child that his father died of drug taking. So we don't just serve the drug abusers, we also serve their family members. And we see countless helpless parents who suffered trauma and guilt. We have parents wanting to commit suicide. I'm in the counseling sector, and there are parents who want to commit suicide, and I can't take care of all of them. Many parents have depression, they are suicidal. Some parents just totally abandon their child. They even moved away. But this doesn't really solve the problem. Drug taking is also related to many problems. It's a form of suicide. And there are family members who sacrifice their life. In a family of 4, one child began to take drugs, and the remaining 2 started to take drugs as well, and the mother became suicidal, and she survived because the remaining child didn't, and that's what we see. Jockey Club Lodge of Rising Sun, Hong Kong Christian Service, Ms. Han Siu-wen. The Lodge of Rising Sun is a voluntary drug treatment center. 80% of our rehabilitees in the past came to our center to quit drugs voluntarily. They understand the harmful effect of drugs. They have the resolve to make a change. If we continue to describe our drug abusers as ignorant, as losing control, and that they have to be arrested, I don't think this is helpful. This may be the conclusion of many of our frontline workers after they get in touch with these drug abusers. Now, this is our concern. We need to help them beat drugs. However, in our experience, there are areas we need to strengthen. As far as the whole drug treatment process is concerned, there are hidden drug abusers, and many parents have come to seek help. Family support or parental support is very important, because parents are the first witnesses to drug taking. But the problem is not that the parents don't know. They are only hiding away from the judicial system. Many friends and many people around the drug abusers actually know. So these are the worries of parents. And if we have sufficient resources, we can help the parents in tackling the problem of drug abuse by the children. And we have cases in the past, and many youths would say that they are motivated to quit drugs. They want to patch up with their families because the parents never give up on them, and this is an encouragement for them to quit drugs. This is not easy because of resource constraints. We don't have much capacity to further help to motivate their children if the parents don't do anything. So we should develop services. For example, social workers can pay home visits and together with health care professionals. I think this is a good way of intervention. I think parents would like to seek help from healthcare or social work professionals instead of police officers to their home to arrest their children. So it should be people-based. The scheme should be people-based, and it should target at the rehabilitation in the long run, rather than taking law enforcement. Next. Ms. Yun Hao-sin from Community Drug Advisory Council. Our council has been serving the community for over 28 years. We are open-minded about the drug testing scheme. Now, we conducted a survey and collected views from our service users. We are worried that if law enforcement officers are involved, it will send a wrong message. Parents, teachers, employers, and social workers, they already form a support network. So not only will they be helpless, it will also become ineffective. It will also cause the support network to fall apart. I have been serving rehabilitees for over 20 years. It's not easy to quit drugs. We think that the relevant elements in the support network could identify the drug-taking habit at an early stage. So what we should do is to enhance the protection network or the support network. First of all, for drug abusers, they should be identified at an early stage, and the cause should be identified, and a focused approach should be adopted in providing help. And crisis and support teams should be set up, comprising social workers and paramedics, to provide support and follow up as soon as possible to enhance support. Only by doing so can we have early intervention. Thirdly, we see new psychotropic substances every now and then. In UK, they have different categories of dangerous drugs. They have 3 categories. For category A, that's the most severe ones, and if law enforcement action is taken on category one of the categories, they may switch to another. Drug testing takes time. If the equipment is not kept up to date to tackle the most popular drugs, it will be ineffective. Some drug abusers might switch to other drugs to avoid detection. causing more drugs to become prevalent. And also, in relation to operational costs and social costs, what are these costs? As far as the scheme is concerned, what is the effectiveness? Physical dependence is easy to get rid of, but not so for psychological dependence. If the drug abuser doesn't have the motivation to quit, how can we motivate them to quit? We should consider these issues. Thank you. Next, Mr. Kong Wai-san from Hong Kong Policy Viewers. Now, first of all, we believe that policies shape our lives. Social policies are very important in this area. We need to consider what are healthy policies, what are not. We attach great importance to human lives. That's why we attach importance to social policies. We see a lot of unequal, unfair social relations because of these social policies. The report talks about early identification. We all know what the problem is, but we are just turning a blind eye. Young drug abusers have very much to do with their social circumstances. For example, our reliance on economic development. What is the outcome to our youths? Depreciation of their academic qualifications, downward social mobility. They feel disappointed and aggrieved. I'm also a frontline social worker. I've heard experience shared by other frontline workers just now, and we understand how the families have become very fragile and helpless. They shed tears because of community problems. And these community problems don't come by overnight. We're talking about identifying individual drug abusers at an early stage. But apart from that, we also need to take a social perspective to identify the problem at an early stage. Otherwise, we don't see how the drug testing scheme can achieve its purpose. Now, coming back to the report, I think behind the scheme it's just crisis induced management scheme. We look at the drug abusers and how they mutilate themselves, how they harm others. We don't want to see this happen. Just like we don't want to see anyone taking drugs. We don't want corruption. We don't want such a political atmosphere in society. It's chaotic, but they are exactly the reasons why our youths are feeling disappointed. In para 2.3 to 2.5, it says that young drug abusers are decreasing in number. It shows that education efforts have been effective. However, the report also points out two extreme cases to show the negative impact on their families, etc. So it's a smearing campaign on youths. We have zero tolerance policies in other jurisdictions. And yet we don't see how the zero tolerance policies help tackle young drug abusers. However, we see other policies more effective.
You need to you need to alleviate the demand and supply. What are the police doing? So does ACAN think that the police cannot target the drugs at source? We have so many police. We have one of the largest police force in Asia. How come they can't tackle the issue? And overseas experience, Sweden, Singapore, UK. we have academic. We need to know the efficacy of these programs. We have UN papers that do not mention efficacy of drug detection. We have housewives from Gaotaogok who can identify drug takers in their estate. So if there's no efficacy, we also don't have recommendations. We have your paper. Your time has you have almost used up 5 minutes. So if our drug policy, if we're not talking about zero tolerance, if it is like STDs, if it's not a taboo, if people can, if they're not afraid of being labeled, then it's not only early detection, it's early intervention. We think early intervention is more important than early detection. It's like venereal disease people are afraid of seeking medical help. You're repeating yourself. Thank you. Next, Mr. Maiqiu, Christian social workers. Romans verses 16:3. It says that those in power and authority get their power from the Lord. So it means the government officials, or when officials are given a mandate, the authority comes from the Lord. So when we are dealing with drug abusers, how do we use government powers to help these people? But if the government doesn't wield these powers wisely, it doesn't solve the problem. In the Exodus, we see that when the Egyptians were in power and abusing the slaves had an uprising. So we need to wield our powers very wisely. So our government officials and legislators, we need to examine how we wield our powers. In the last 3 CEs have disappointed us, so I believe officials have a tough job. The drug abusers, the victims, why are they arrested? Why do they have to do drug testing? As Mr. Kong Wai-sum said, shouldn't we catch the perpetrators, the drug dealers? We also have to deal with smoking, alcohol abuse. But in moderation, the Bible doesn't prohibit the use of alcohol. If we smoke in moderation, I've heard that smoking might help Parkinson's disease. What if drugs are used in moderation? We have good intentions when we try to help drug abusers, but is drug testing effective? We've heard of reports of parents who are helpless when their children take drugs. So if parents suspect their children of taking drugs, this is something we need to examine. When we support these people, We need to touch them with love. We now rely on police and I question the efficacy of this approach. Our society is very competitive. The whole society is competitive, and even remedial measures need to be considered. Let me stop here. Next we have Mr. Tang Wing-Fai from Hong Kong Christian Institute. Nobody wants to see damage from drug abuse. We all agree that drugs have a big impact on health. Is it because we don't want people taking drugs and therefore we support drug testing? Mandatory drug testing might be useless in drug rehabilitation. It might even have bad impact on early detection. The paper says that the drug taking issue is being driven underground, and amongst the 20 to 30-year-old group, it's very easy for them to hide under the radar. So, as some people have said, the drugs being taken are changing constantly, so it's very easy to avoid detection. So can drug testing really help rehabilitation? As a Christian institute, we believe dignity is very important. An important area of human dignity is through protecting human rights. If we implement drug testing, it infringes upon human rights of privacy. Under the IPPR Convention, this is safeguarded. Let's assume we also need a person is also deemed innocent until proven guilty. If that is transgressed, I'm afraid the rule of law in Hong Kong would not be respected. Just now we also mentioned that drug taking is a social problem, but I'm worried that why do we have to look for individual solutions to a societal problem? The example of Sweden was quoted. We need to clarify that Sweden is a homogeneous society. They are Protestant. 80% of them are Protestants. The median income is very high. The income gap is small. So in this environment, less people would be affected by drug taking, and international drug organizations have done research in Europe. There's no evidence to indicate that drug testing in Sweden has brought down the drug taking numbers. In Holland, in coffee shops, you can purchase cannabis, marijuana. But drug figures in Holland are low. So we do not necessarily have to implement drug testing to bring down drug taking figures. There are other equally viable options. Thank you. Mr. Kam Man-fong from New People's Party. In principle, we support the government drug treatment and rehabilitation service. We all understand that drugs affect society. The law only allows urine samples when the subject agrees. We think this creates obstacles to police work. So we hope the program can help us detect hidden drug users and help them rehabilitate. So even though we agree in principle, we do have suggestions. First, when or under what conditions should police ask for mandatory drug testing? Yes, when they discover drug paraphernalia in the person's vicinity, when the person's behavior and speech gives rise to suspicion of drug taking. When the program is implemented, we hope that the public can be educated, that police powers will not be increased. Police have to conduct a visual inspection. Oh, this is too subjective. Is it possible to adopt scientific measures before urine testing is implemented? We don't want to rely on police officers' visual inspection. The public would be very worried about this. If we have one or two unsubstantiated cases, then it would lead to a public worry. A lot of speakers have said that mandatory drug testing is not sufficient. So aside from supporting drug treatment and rehabilitation, we would support a multi-pronged approach. We should target drugs at source. How can we stop drug dealing? How can we work with the mainland PSB to stop drugs coming into Hong Kong? We also need education. Education in school and education at home. When the young people demonstrate erratic behavior, the government officials can now respond. Well, whether drug taking is a minor offense under the Dangerous Drug Ordinance, the sentence for drug trafficking is the same. It's a $1 million and 7-year sentence. Of course, drugs have an influence on personal health, society, and family. The drug testing measures, are these effective? In Hong Kong, we have driving under the influence of drugs and medication. Regarding innocent until proven guilty, the Court of Final Appeal has ruled that this cannot be breath analysis, the blood sample and urine sample. An overseas experience, we've heard Sweden being quoted. In Sweden, they have a drug testing measure. It's not unique to Hong Kong. Of course, their success or failure in Sweden does not have any influence on Hong Kong. Under their zero tolerance policy, the drug taking problem compared to other European countries is much lower. For example, in marijuana use, in 2004, their marijuana use was Europe was 7.4%, and in Sweden it was just 2.2%. Antonio Costa had reported that Sweden's experience was a worthy point of reference, and in Hong Kong,
we have a voluntary school drug testing scheme. Now, the scheme has been expanded to every district in the territory, but in 2011 in Tai Po, we conducted some research, and we found that the drug taking level in that district was lower than other districts. And according to a student survey, the growth in the number of drug abusers in the district was less than other districts. So you can say that drug testing does have a preventive and deterrence effect. And in the 10,000 newly reported cases in the Central Registry, this is, comparatively speaking, we don't have sufficient services at the community level. We have drug abuse clinics, 11 of them in the community, and we also have some 1,500 residential places. And among the 10,000 cases, some of the drug abusers are admitted in CSD institutions. Some are followed up on by social workers, and some are admitted in residential rehabilitation centers run by voluntary organizations. We understand that many of these centers are in substandard conditions, and we are helping them in looking for sites or upgrading their standards. However, the community very often has strong views on these facilities, and we are trying to help them relocate their facilities. And finally, I'd like to thank the panel for inviting us to listen to views from Deputations. We put people first. Human lives are important. That's why we are not suggesting that drug abusers identified under the drug testing scheme should be arrested. We are suggesting that an alternative pathway should be provided to them so that they can be helped. And I'd like to defer to my colleague, but please be brief. Now, I'd like to supplement that despite the decreasing number, we still need to put forward the scheme because the data on reported drug abusers is largely based on heroin users instead of other psychotropic substance. I believe not everyone here realizes the fact. In particular, in relation to a survey on secondary students at the community level, the number is far greater than that reported. Now, for drug abusers using the ICU service, the number increased by 9.8 times over the past 2 years, and many of them many of the drug abusers suffer from psychiatric symptoms, and 30% of them eventually receive disability allowance. So it's not just about the community problem happening here, and this cannot be resolved by paying home visits. Drug abusers may eventually suffer from lifelong mental disease, or they may have urological problems. They may need to carry a bag for the rest of their lives. The existing law is flawed with a loophole. For example, as mentioned by a social worker, if you take a drug abuser to a healthcare professional, you can only compel the person to medical treatment when he displays suicidal symptoms or psychotic symptoms. Some ask whether this scheme is effective or not. Let's talk about the news yesterday. Nothing could be done before the drug abuser chopped his family members. Even if the family members called the police, they could do nothing. We talk about Holland. Holland had it has a low drug taking rate, but in terms of the rate of psychiatric illnesses, it stands among the highest. So if early intervention is not possible, they will suffer lifelong problems. If somebody cannot even walk straight, if the person can't even tell the name of their family members, and yet the police must stay put, then that is a problem. You can compare the figures of drug taking or drug driving or drink driving, and also other harm caused to others. For example, throwing off objects from height and assault on others. You can see the figures are much greater than drink driving or drug driving. So this can provide an alternative avenue without having a conviction record. If you look at the UK system, they are able to save 4.4 million a year. So if the service is properly regulated and treatment can be provided, what we're doing is a more innovative approach. We provide compulsory treatment without the need to have a conviction record. And this is something new in the world. Thank you, Dr. Zheng. We have 7 members wishing to ask questions. Please be prepared that we will take more than 30 minutes for that, so 3 minutes each. So please be prepared that it will take beyond 30 minutes. 8 members. First, Dr. Kokaki. Thank you, Madam Chair. Now, I'd like to thank all the devoted staff and former drug abusers for coming here to share your experience. This is not a across-the-board approach, as said by Dr. Zheng and other government officials. This is the actual experience, and I also came across some patients and they needed to urinate every 5 minutes, not 15 minutes. They need to carry a Coke bottle with them as they ride on a bus. So the important thing is whether it is effective or not. And I find it hard to accept the government's suggestions. As Dr. Zheng puts it, the reported drug abusers can't reflect the true situation. I have come across drug abusers with a drug history of 10 years. The government didn't know. And if you go to North District and Yuen Long, the schools can tell you ketamine abusers in primary schools, they don't lose control. These students just look dull with white-colored powder on their nostrils. So what can be done? They need to wait for 14 weeks or so for voluntary treatment service. And those are the abusers willing to go on their volition. What about those who are unwilling? Government-run clinics, well, the queue is as long as 1 or 2 years. Some might be fast-tracked, but not others. Some might not want to be labeled. They might visit urology clinics instead. So the government should shoulder the responsibility and provide more resources. Please tell me how you can shorten the waiting time and how many more places can you provide. Response? Commissioner, can you take this question? I'm trying to find an official from the Security Bureau. Commissioner, see if you can answer this question. If not, somebody from the Security Bureau. On residential places, 75% of the cases could be admitted within 2 weeks. 97% of them could be admitted within 2 months. Admission rate is about 70%. Dr. Kwok talks about the burden on our healthcare system, and this is exactly our concern. The Beat Drugs Fund allocate funding to hospitals to tackle urology problems among youths. That's about allocation of resources. Some ask why young drug abusers could get the help they need, whereas for elderly patients, they need to wait for a year or two. We want to show you that aftercare service is important, because not only the individual will be affected. We understand that there is a need to increase resources. After we come up with a proposal, and the resources should be increased accordingly. I think this is the indisputable fact. Mr. Chong Yiu-kwong, you'd like to respond as well? Please be brief. 1 minute. Now, about dangerous drugs ordinance. Smoking of dangerous drugs can attract a 1 million fine and 7 years of imprisonment. However, I checked. Smoking a dangerous drug is not an imprisonable offense because Section 54 talks about probation or fine or DATC. The person can only be imprisoned if he commits another offense at the same time, which can be punishable by a sentence of 9 months or more. The other response is on the typo school drug testing scheme. It's been regarded as a success because of the education publicity effort. What about the students' awareness on the harmful effect of drugs? On the figures, that doesn't seem to be the case. And apart from typo districts, students in other districts have fewer misunderstanding on drugs than typo students. So under the existing mechanism, the court authorizes the police officers to test drugs, but now I don't see the justification to support a change in this policy. Mr. Chen Chi-chun. Well, thank you, Deputations, for coming to this early meeting at 8:30 to express your views. You're all concerned about drug rehabilitation treatment in Hong Kong. Now, I need to state my position. I am against this rescue drug testing scheme. This is just a pretext for expanding police powers. I think more effective drug rehabilitation and treatment service should be provided, but then we need to consider whether the policy is a good one or not. I understand that the feelings of family members of drug abusers and staff who have been providing rehabilitation service for many years. You tried your best to help drug abusers. You try to help them quit drugs as early as possible. However, we really need to discuss whether the scheme is effective and how much can they be helped and what will be compromised. Now, some say that is a balance between human rights and police powers. Now, I raised the suggestion for a public hearing at the panel on security, but my idea was opposed because the chairman said that there will already be a public hearing at this panel
But the Security Bureau has not attended. The police have not attended. The Commissioner says it's a 5-pronged approach. We're talking about treatment and rehabilitation today. But this is not just treatment and rehabilitation. We're talking about legislative work. You cannot separate the two. So we cannot have a joint security welfare panel. I want to express disappointment. We cannot hear the police opinion, and targeting drugs dealing at source cannot be handled as well. I'd like to also talk about the topic about parents helpless with their children. Well, how much can this program help? Could she call the police and plant some drugs nearby? Or is this just false hope for parents? Your child can be arrested on the street. Is this just hubris? An extra tool? I don't see that. That's an expression of opinion. Next we have Tangabyu. We have to thank the individuals sharing their personal experience. It's not just the methods and human rights issues questions are raised in our discussions. Since we're talking about plugging the loophole, so how many people do you expect will have to receive rehabilitation? Second, can the current resources handle the workload? You might say, in the long run, with early detection, we can reduce the workload, but we have a lot of frontline workers now here. Do they have sufficient resources? In, let's say, paragraph 11, the Audit Commission says there are 22 drug centers that are not up to standard, and there are an extra 2 receiving licenses. So if the legislation is endorsed, there will be a surge in demand. And these drug abusers, they will appear on the radar, but will there be resources to help them? Commissioner? At this point, in the 40 residential centers, 23 have received a license, and the other 17 have not received license. Some cannot build their site in situ. They need to find a new location. In the past, we've examined some 300 sites, such as old schools, but the residents' concern about drug rehabilitation created obstacles to using these sites. We also have a case of in situ rebuilding, and the work is ongoing. The Beat Drugs Fund will finance these projects in targeting the source. You plug the gap. So how many extra people will undertake drug testing? We have discussed this with our counterparts. Can they forecast the figures? This will relate to use of resources. So assuming this is feasible, In the paper, we had mentioned a simple action in Yao-Ma-de-Jim-Sa-Zhui area, where they raid karaoke bars. We see hundreds of young people. They have drug-taking symptoms, but there's no way of dealing with them because under the law, there's no mandatory drug testing. The police can give them a choice of whether they want to receive social worker help. But their rate of acceptance is very low, less than 30%. And the police tell us that in a month, they might see the same person more than 3 times. We see there are a group of people. There is opportunity for intervention, but there's nothing that could be done. We're just talking about adding an intervention point. We have more and more members joining the discussion, and I have 8. I don't think we can handle it by 10:45. We would. I'd like to give everybody a time for discussion. So let's extend to 11. With your agreement, we can continue. Mr. Zheng, we're not just talking about how to help the youth. When we amend the law, after hearing from the deputations, the frontline workers support our work because they are at ground zero. But those further away from the drug takers have different views. So this reminds me the mainstream view, that is not the frontline workers' view. There is no consensus in the mainstream. So I feel, if you ask me whether I support it, I don't support it because amending the law is irrevocable. We see any policy regarding targeting drugs at source. There is insufficient support of drug rehabilitation, and some rehabilitation centers don't even have a license. They might have hardware but no software. And waiting in line for 10 weeks is unacceptable. If I want to kick the habit today, I want immediate service. So if you tell me to wait a few weeks, my mind might have changed dozens of times. So in light of this situation, I don't see how can endorsing the law help when there's insufficient downstream support. There should be room for more discussion about downstream support. Even with a lot of money injected, you have to see whether the money is well spent. A lot of service providers, for example, Zheng school, are you a school? We just treat it as a school, but the government doesn't treat it as a school. I'll give you an example. We don't have sufficient time for discussion. Even if you extend it by 30 minutes, we're not talking about drug rehabilitation, there are security issues as well. Zheng asked Jing Sung School a question. Would Jing Sung like to respond? We are a formally registered high school, but under government policy, there's no drug rehabilitation school. In our experience, giving them an opportunity to learn is very helpful. Mr. Leong. I would like to thank the deputations on behalf of the Civic Party. Leong Wai-man and Gok Ka-kei have already described the Civic Party's stance. I'd just like to follow up on the Vice Chairman's comments. When we're talking about the typo drug testing, just now I heard the acting commissioner say it's an undisputable fact that we need to add resources. Well, if it's undisputable, why isn't there any rationale? Why don't you tell us how much resources you want, how the resources will be spent? The objective outcome is that you're increasing police powers. The confirmed drug takers will be labeled. Then what? Thank you, Mr. Leong. The consultation poses the question that under human rights concerns, is this feasible? If so, the next question will be, who should be given this opportunity? Those under 18 or above 18? And the two approaches will be different. I'm not being disrespectful. Chairman, I think this is putting the cart before the horse, and this is a typical example. You have to tell me what your comprehensive plan is. You cannot say, I want to test the waters in principle. I would like to tell Professor Sekdani that's not the way, that's not the approach. If you enhance police powers and you find that it doesn't achieve your desired outcome, and if the mainstream society can't identify the problem, and if we don't have a policy to handle the question, then when you say to test the waters in principle, this is impractical. Mr. Yik-ji-meng. First of all, I want to thank the different speakers. I agree with some speakers. It's not an individual problem. This is a complex social problem. Soft drugs are like a disease. It's contagious. I heard Zheng Gokchu's observation. He said that the frontline workers, the closer they are to drug takers, they support the government policy, and those further away have a more macro view. I agree with Mr. Leong. The government should have a comprehensive policy. You need to enhance your detection powers, and they need to be given more follow-up options. Of course, there are some concerns regarding abuse of law enforcement powers. The New People's Party said that reasonable suspicion and circumstantial evidence. You might also want to look at the details.
This point is important because people are concerned whether there will be any abuse of powers. Just citing an example, what is meant by reasonable suspicion? There is a list of 10 and you can check 5 positive. I have sympathy for drug abusers. They might start taking drugs for various reasons. I very much support giving them early intervention and help. But I am just here to listen to views of deputations. Our party doesn't have a stance yet. We haven't had a discussion on it. Now, there are different views, for example, stepping up effort on publicity and education. But time is needed, and the topic has to be fermented in the society. And before there is any actual scheme to be implemented, I think it's the right direction that we look for early identification. Yes, Commissioner. Now, I'd like to reiterate, and in response to members' suggestion, that we're not going to legislate as soon as we finish this discussion. Like Professor Sheng said, if we're subject to members' support, we will roll out a second stage consultation. Of course, we will discuss with members of the community and members here on how to improve the services. Dr. Fernando Zheng, thank you, deputations, for coming here. Thank you, Commissioner, for explaining this plan to us. This is a so-called compulsory community drug testing scheme following the school drug testing scheme. Legislative amendments will be necessary. A harder line will be taken on the taking of soft drugs. Now, there should be enhanced support from social workers and schools. And it seems that the topic is controversial. We have diverse views. I cannot agree with Deputy Chairman that for those closer to this problem, they are all in support of the scheme. Even for frontline social workers, some of them oppose the scheme. By taking a tougher stance, it will have greater it will achieve a greater effect, but there are problems as well. We don't see strong evidence from any jurisdiction showing such scheme will definitely work or definitely fail. But if we are to implement it, we must deploy resources. So how should we accord our priorities? On the heavy-handed approach or otherwise? Should we rely on police officers to detect these cases for compulsory drug treatment? The Commissioner said aftercare service is very important, and they have yet decided the way forward. It's subject to discussion. Resources can be increased, but the direction is still unknown. So like Mr. Alan Leung said, this is putting the cart before the horse. You are first defining drug-taking problem as a heavy-handed approach to tackle drug abuse problems. So do you have a question? If the government doesn't have comprehensive plan, well, your time is running out. I'd like to ask the deputation, if resources are unlimited, would you allocate resources on enhancing services or on this drug testing scheme? Well, but your time is almost up. I see Mr. Zheng would like to take your question. 1 minute, please. In fact, the government doesn't say after legislation that it's possible police powers might have to be increased. After drug testing, after the screening test, 2 or 3 hours later, urine tests will have to be conducted, and if the youth is under 18, he will need the attendance of an adult. So it will take a long time, with manpower implications. And the police might say that they don't have sufficient manpower. So we'd rather allocate more resources to enhance outreach service or other social service. Or should we deploy resources to increase police manpower? So this is a question, and the consultation is not sufficient. Yes, other deputations? Thank you. Mr. Lam Hei-sheng, Sheng College. Now, our position is as follows. Now, some members say that we need to have all the supporting facilities and services before we implement the scheme. However, I'd rather we identified those who need help and those contagious ones first before we step up our supporting service. Of course, as service providers, we welcome more resources so that we can do better. This is for sure. However, we are not able to identify patients. We don't know where they are. They are all hidden away. So how can the government give us resources? Next, Mr. Wang Manxing. I'd like to respond to Dr. Fernando Zheng's question. This is a romantic hypothesis. Imagine resources are unlimited, but we all know that resources are limited. Last year, we ran a voluntary drug treatment center. If we have unlimited resources, then honestly, we need, for example, psychiatric nurse in our team. As mentioned by deputations and doctors, to a great extent, many drug abusers nowadays have psychiatric issues. And in residential homes, very often they use bunk beds, and many drug abusers have urological problems, and they still need to climb up and down the bunk beds. Is difficult for them. Now, resources and increasing police powers, there is no conflict. We're trying to help those who cannot quit drugs on their own. We hope to include them in our network. Next, Mr. Albert Ho. I'm grateful for deputations once again for attending the meeting and expressing your views to us. I'd like to know about several matters on our effort in tobacco control. I understand that Hong Kong has done a great job through publicity efforts in the past years. The number of smokers have substantially decreased. What about drug abusers? The average age of drug abusers have been on the rise, and this is a sign. We are concerned whether there has been any improvement or whether the situation has deteriorated. Despite all the publicity effort, what is the picture now? And there is a sense of urgency, and the government and friends of the sector would like to improve the situation. And some suggest something sort of a harsher punishment. Tough laws, harsh punishments. So you can't say that it's not effective. You identified those hidden drug abusers and do something about them. That's one approach. but there is a demand for rehabilitation treatment centers, and you have a long queue. So even if they are identified, it doesn't mean the problem can be resolved at once. Now my question is, you identify the drug abusers and help them quit drugs, but how many of them relapse eventually? There are structural problems. Some will relapse into the habit, and some are really committed in identifying these drug abusers and help them quit drugs so that they can rebuild their lives. I believe that for the people you helped, there is a little chance for them to relapse. But there are still some drug abusers going in and out of drug treatment centers. So it is important to step up your work in the upstream and midstream of the chain. So please tell me, how many of them relapse or reoffend, Commissioner? Now, as mentioned by social workers, on average, as mentioned by fellow workers, a drug abuser might take 7 or 8 times before he could finally quit drugs. But once a drug abuser successfully kicked the drug habit, then in future it would be easier for the drug abuser to quit again. Different users have different approaches to quitting drugs. Some rely on religious support, some don't. But it is not an uncommon phenomenon that you need more than one drug quitting treatment, and over 50%, according to the statistics from the database, that requires repeated drug quitting effort. But should we deny them a second chance, or should we deny the result of the first drug quitting treatment? That is a problem. This is a structural problem. If this just repeats, then it's useless. Any response from the deputations? Mr. Lam? According to Zheng College, if we have sufficient resources, sufficient time, we have a success rate of over 70%. We have many drug abusers who can kick the habit just once. Next is someone saying 1 minute. Drug taking may be a one-off thing, but drug quitting is a lifelong thing. So every time a drug abuser tries to quit drugs, it lays a foundation. We really hope that finally they can quit drugs. We have 1,800 rehabilitees every year, and the rate of relapse less than 5%.
Once they join our system, they receive 12 months of service, and 50–60% of them kick the habit successfully. Our major concern is, how do we help those who do not intend to kick the habit and allow them the first attempt? Mr. Kong Wei-sam. When they return to the community or government housing, they still live amongst drug dealers, triads, the drug-taking peers. Assuming they live in government housing, how can they relocate? There might be a lot of constrictions. Why do they relapses? Peer pressure. The living conditions, the community. And we also see that the society hasn't changed. There's no hope. Some people might need a job or go back to school. But how does society take them in? They are labeled. How do we delabel them? We talked about structural issues. These need to be dealt with. Mr. Samwai Lam. When I see we have a lot of social workers, on one hand they say the drug takers need to be helped and they need to be identified. So we haven't discussed how to identify these people. You can't give us a clear picture. Why are you so confident that this can help identify these people rather than driving them further underground? And on one hand, we say we want to help them. On the other hand, we label them. For example, you say they are violent, they have psychiatric problems, they are a danger to society. Well, if that attitude is adopted, these drug takers cannot integrate back into society. We still have 3 colleagues. Mr. Leung Ji-chang. I have to thank the deputations. I agree with Dangapiu. We should have a joint panel discussion, especially regarding the commissioner might not have security information. I want to focus on drug rehabilitation and treatment. Now, I forecast that if the law is endorsed, then next year it should be able to be implemented. Then the Commissioner for Narcotics, has she done any forecasts on the hidden drug users? And if they identified they need to be rehabilitated, then according to your current workload, then from your perspective, what is your capacity, your workload capacity? Have you done this preparation work? If not, then when the law is enacted, you will be caught unprepared with the extra workload. Well, whether we will legislate next year, that is very optimistic. As Professor Sektanle said, after the first round of consultation, if we feel that we can take the next step, then we will conduct another round of consultation regarding the details of treatment and rehabilitation, and legislative work would take even some further time. We are now in discussions with frontline workers, drug treatment centers, for example. Which group should we target? So the whole infrastructure will depend on where we draw the line. We need to know, we have to identify the boundaries of our problem. Well, if this legislation will take 2-3 years, then I suggest you drop it, because these hidden drug takers have been doing drugs for a long time. Our meeting this morning, we had invited security panel, but they felt it was not necessary. Mr. Wang Yokwan. On the 5th of November, the security panel had discussed this problem, and they thought the government would legislate. My stance is very clear. I disagree. In the security panel, I expounded on Article 28 of the Basic Law. If you grant an institute, if you give them a mission, they have to be given the powers. So police are they to help rehabilitate drug users, or are they to bust drug dealers? So the NGOs, service organizations. Just now we heard Zheng NGOs provide rehabilitation. Of course, that's very important. But in the past, we had 22 drug treatment centers who couldn't comply with CAP 563 licensing requirements. So the government is always very passive. You should assist these drug rehabilitation centers and help them get their license. I think that's a more pertinent question. Drug treatment, rehabilitation, this, of course, necessary. As the medical professionals say, you are adopting different medicines to the patient. So we have a lot of talk, and some people ask you, how are you going to identify? You're saying the police will identify them. Well, police have to bust the drug dealers. They have to raid karaokes. And on the other hand, they have to go help them rehabilitate. And Professor Saktande says we have a precedent, but these are two separate issues. If you're driving under the influence of drugs, there's legislation against drug driving. So, since it's going to be legislated, you have to be very careful and solve all the technical problems. Thank you, Mr. Wong. Let me clarify. In the 40 residential centers, 23 have a license, and we are assisting the centers in situ rebuilding, including Zheng College. Well, first of all, I have to thank the deputations. Society is concerned about this issue. We have frontline workers serving the youth. We also heard some people calling for comprehensive plans. So I'd like to ask the officials, you see frontline workers working so hard to help people kick the habit. So when the government has a new policy, but there's no follow-up, and in the welfare service panel, the different parties have all asked you, you don't have any follow-up plan. Some people have called you to resolve technical issues and so on. Well, you really do need to go back and examine the problem. We should have the secretary, he should join this panel discussion. I see that Zheng has done a lot of work, but the government has not acknowledged their work. As said just now, we have 17 institutions that have not received a license. Why does the Welfare Service Panel have this special panel? It's because we want to see what has happened. We want to see why young people take drugs. I think the Commissioner, you haven't finished your job. Cheng has asked you how long will it take. If you're saying that I'm aware there are a lot of problems, I can't complete all the tasks ahead of me, but you need to give us a timetable. How will you deal with the rehabilitation centers? So you need to respond. So after hearing everything, you need to tell us how can you help the frontline workers. You're giving them a hard time, and you need to provide infrastructure support. Thank you for your views. We have been in constant communication with frontline workers. We see there has been an increase in resources for rehabilitation. And in the Secretary for Justice, Wong Anlong's report, we have ever since increased the substance abuse clinic centers. We now have a substance abuse clinic in each district. We're helping a lot of institutes, but this takes time, and it is ongoing. We are also trying to enhance the depth of our service. After the 2008 report, there has been an increase of 20 school social workers. We also increase, and the increase in resources will never be sufficient to deal with the problems. Why do we maintain communication? It's because we're not a service provider. The service providers are sitting opposite us. We need to hear from their experience, and if we formulate mechanisms in an ivory tower, it's easy. But is it effective? Does it serve the clientele? during this consultation where you do not answer our questions. I have said you need to give us a timetable. Assuming next year when the law is endorsed, do you have follow-up? We're not even talking about police powers.
Well, we're only talking about help for the drug abusers, help for rehabilitation. Now, we have heard about difficulties faced by service providers like Sheng. No help has been provided. So please, you must understand that our colleagues would also like the government to do something to face up to the problem. Now, this government looks at children, looks at the working poor, etc. And I feel that the government is making effort in this area as well. But, Commissioner, you must do more. In terms of aftercare, and also to resolve existing problems. I think this is the government's practice. They just pass the buck around without doing anything to resolve the problems. So tell us the timetable, how to improve the existing situation. Thank you, deputations. Thank you, members. And thank you for telling us your story, including your philosophy. We are going to follow up on the issue. Drug abuse should be under the purview of Security Bureau, but I will also step up our effort. Thank you.